Hello, I'm Lauren Haldeman, Editor-in-Chief of the Journal of Nutrition Education and Behavior, where we are advancing research, policy, and practice. Each month, we select an article to feature as a press release with an accompanying podcast. And today's podcast article can be read in full at www.jneb.org for free for the next 3 months. And today I'm really happy to be speaking with Dr. Andrea Begley, who is the corresponding author for the article titled Determining the Effectiveness of an Adult Food Literacy Program Using a Matched Control Group. I'm glad to have you with us today, Andrea.
Thank you very much, Lauren, and to the Journal and to all the listeners who will be involved in the podcast.
All right.
We're very pleased to have been selected for this month. So I speak on behalf of all the co-authors.
Wonderful. Thank you. And can you tell us a little bit about yourself?
Yes, so I'm a dietitian by training. In Australia, we call this, so I'm based in Perth in Western Australia. The equivalent to registration is an advanced practicing dietitian. I'm currently the Director of Learning and Teaching for the School of Population Health at Curtin University. And in my other role, I'm a teaching research academic. So I have a small component of research. And really, since I completed my Doctor of Public Health in 2012, which was really looking at cooking skills and health, as part of that, I sat in and looked at some program evaluation. We've had a long history here in Western Australia around what we would call food skills type programs. In America, I think you've called that sort of food resource management skills, and we've really evolved in Australia to talk more about food literacy, really the skills you need in terms of planning, selection, preparation and eating to be able to feed yourself. So I had some unique experiences, and that really led me to being asked by the Department of Health here in Western Australia to develop some best practice criteria, because we have a commissioning way in which programs are funded at a state-based level. And I think I really became aware in 2014 that there is just very little literature, that we all think these are really good programs to be running. Really common sense approach that obviously if you teach people some skills, they're going to be able to choose healthier foods, but very little evidence around effectiveness. So I've had the opportunity through this program, the Food Sensations for Adults program, which has been run by Food Bank, as in my role as the external evaluator, where I report to the Department of Health, to have a couple of years to really think about how we best evaluate some of these programs. So I'm really happy to talk to you today about the work we've done in this paper.
Great, and we're real glad that you were doing this work. Can you tell us a little bit about the actual study, maybe some of your findings? Give us a little bit of an overview.
Yeah, certainly. So the Food Sensations for Adults program is a 4-week program, 2.5 hours per week that participants come to. It's a free program offered either to community groups or advertised to general public groups. So we get a variety of people come along to those programs. It was targeted for people from low to middle incomes, as in the specifications from the Department of Health, with really the aims around trying to improve people's skills and confidence and intentions to try healthier eating. So I have been involved in the evaluation, and we collected pre and post program data. We've spent some time thinking about the tool that we used, and I must admit I looked to the States and looked at the FNET program and the evaluation that had gone on there to really model our what we call our food literacy behaviour checklist that we've published some validation on. And we published sort of pre-post evaluation. We've looked at post to a 3-month follow-up. And all of that is really useful information and was useful for the Department of Health. But of course, unless we can try and match it to some sort of, form of control group, then the results really are not as strong as they could be. So for this particular paper, I had a discussion with our statistician, and I really highly recommend everyone go out and get themselves a really good statistician. We have an exceptional statistician, Satvinder Dhaliwal, who really thought about how we could best evaluate this, and really taking quite a pragmatic approach, Lauren, because the funding that was provided by the Department of Health covered the sort of standard evaluation, but not obviously doing an experimental type evaluation. And it really was his idea to think about doing a matched control group. And what really helped us with that is we'd published the validation, we'd done some factor analysis on the food literacy behaviour checklist. So this was modelled really on behaviours such as planned meals ahead of time, where people scored themselves in terms of the frequency that they did that, you know, rarely, never, sometimes, etc. Again, modelled on some of the early FNEP questionnaires. And he was able to work out really a sample size based on those particular factors for us that became quite realistic for us to recruit. So we involved a student dietitian to get the experience, but also for the labour. And Isabel Fisher went out and recruited a control group. And the idea was to try and match this control group based on several demographic characteristics. I guess the other area that I had also looked at was some of the work done for Cooking Matters in the US, and I had always liked the paper published in JNEB, and I had a conversation with Jennifer Pooler early on a couple of years about that, which used a sort of similar process. So all of that's been really helpful work to guide our work here in Western Australia. So we recruited a matched, you know, we used convenience sampling to look at people surrounding our food bank where the program was being run from across WA, and collected, essentially people did the pre-post questionnaire that we had developed that was used for the program evaluation, but they did this obviously without being involved in the program. And there were 17 questions, the food literacy behaviour checklist, as well as we had 8 questions around demographic variables, and also just checking that people hadn't been involved in any sort of food literacy program previously. What we did was look at the time frame that we collected that matched control group in, and looked at the data we'd collected from program participants and went back 1 year. We tried to keep it as close as possible to the similar time, and we decided we would be able to match on sex and gender, and something in Australia we call a CFA Index. It's a socio-economic index for areas. It's calculated from our population census that involves several of the variables in the population census to really look at comparing areas of advantage and disadvantage. So we thought those 3 characteristics would be sufficient, and our statistician took all the data that we had from program participants and looked at, you know, males aged 18 to 25, and then the different CFA characteristics, which we were looking really at high, middle and low. So we were dividing the participant data down into those categories and did what we called nearest matching, so a sort of random allocation based on the control group characteristics that we had recruited. When we first ran the comparisons between what we called the pre and post data of our participants, or time 1 and time 2 for the control group participants, we found that in fact the control group participants had high T1, or the, you know, pre-program kind of scores. So we went back into the data, and the statistician decided that we should look at education and employment as well, and use those as covariates in doing some general linear mixed models. And so that gave us a much better outcome in being able to compare our results. So in terms of our food behaviour checklist that we have for this program, when we've done factor analysis and looking at the validation of that, we find that 3 domains come out. We have a planning and preparation type domain, we have a selection domain, and a planning and manage, a selection and a preparation domain. We were not required to collect dietary data for the Department of Health here in Western Australia's evaluation, but we did ask about serves of fruits and vegetables. We felt it was important for the program generally, and they're relatively, validated questions to be asking. So when we did the comparison with the matched control group to the program participants that had been they'd been matched to, we found that 2 out of the 3 food literacy domains significantly changed in the program participants, but not the matched control groups. And we found that serves of fruits and vegetables significantly increased in the program participants. So we were obviously, quite pleased to see those results. So what we do is we describe this as sort of modest. We saw statistically significant but modest changes using the quasi-experimental method that we had for this particular paper. Then, of course, trying to compare our results to other results is really challenging because, as I mentioned before, despite all the work and the investment by governments in this area, there really aren't very many papers published looking at, free living community people, organisations being involved in these sorts of programs, having some sort of quasi-experimental design trying to evaluate their program. So when we looked around, we could really only find 1 Australian program and a couple of other international programs, and I think the States really has led the way with some of that particular evidence. But really from what we can glean, I think our increase in fruits and vegetables by half a serve is fairly in line with other programs, and our comparison really to the work that FNET's done, Cooking Matters, again, we felt quite confident in the change that we had really seen in those particular programs.
Great, thanks so much, Andrea. I like that tip about having a statistician in there as well. One of the big questions we face as nutrition educators is how long should a program be in order to affect behavior change? Food Sensations is a short program when compared to others like FNAP. So what do you think makes the program effective in changing food literacy behaviors, the ones that you measured?
Yeah, it's a really great question, Lauren, and it's something that I have spent several years thinking about. Back in 2014, when I had done some review for the Department of Health of their previous contract, spoken to a range of stakeholders, I kept being told, look, 3 to 4 weeks, Andrea, that's all you'll get people to come to. If the Department of Health's going to refund a program, you need to be looking at those number of weeks. But of course, if you look in the literature, it would tell you that behaviour change really is going to occur over a longer period of time. I think what I have reflected on in my experience in sitting in these programs, I'm a qualitative researcher by nature. I've run quite a few focus groups with program participants, excuse me, as part of this evaluation, is that I think food literacy skills are acquired over years, over time. Not maybe a lifetime, but I think they're an evolving set of skills. So really, how much change can we expect over, X number of weeks in a program? Because I think it's really what we're seeing are quite small effects in a number of variables. So, I mean, our questionnaire has got 15 questions. So it's those small incremental changes, those smaller effect sizes that add up over time. So I also think we have to think about people and just constraints in households and really some of that change that occurs. One of the process evaluation questions we have is, what could be improved about the program? And sometimes what we get, and I think we've got about 20% of responses, is, can there be a version 2 or a more advanced programs? It's kind of like people can only do so much and then need to put those skills into practice, that behaviour change, and then almost come back and have a continuation of that. I think it's really important when people are describing programs to really work out this is a 10-hour program, 2.5 hours over 4 weeks. I have sat in other programs where the first week might be really filling in evaluation questionnaires. I've been very conscious with this program as the external evaluator and designing the evaluation to make sure that the evaluation got what we needed to report to the Department of Health, but didn't take away from program delivery, because I've seen people really turned off by that. And again, I think that's negotiated with the funder and the really thinking about what you're doing. But, if people come along and they've presented with all this data that they've got to provide, I think that's really challenging for them. The Food Bank WA facilitators really have focused very much in their program design around behaviour change techniques. So goal setting is really embedded in this program. And again, I think we need to really unpack why these programs work. We just can't get people together. So Food Sensations for Adults has 1 hour of education, which is very experiential. There's not a PowerPoint in sight. It's very hands-on. Then there's really another hour of cooking with a whole range of different recipes that are often selected by the participants to try. And then time spent eating together and talking about the food. So, I think the combination of education and training and trying to unpack what is it specifically that is changing behaviour in the programs is really important for us. And I really give credit to the facilitators, because a big part of this, and I really learnt this, I spent time at Colorado State with Susan Baker and Gary Old in 2018. I was on sabbatical, very welcoming. I went out and sat in a number of FNET programs, and whilst that's a peer educator program, I think what I really took away was the diligence around implementation fidelity. And just how important that is to be really confident about the program delivery. So, I don't have a magical answer about why this, a 4-week program worked, and particularly for this match control group, we looked at participants who'd completed at least 3 of those 4 weeks, 75% of the program. But I think that's a question we need to answer better about what is it? What are those magical components in the program, those behaviour change techniques that are really contributing to what we want to the outcomes to be, which is really changing people's food, nutrition literacy as determinants then for the diet quality that we want to achieve.
And all of these are fabulous points and things that we really need to be paying attention to when we are developing anything nutrition education related. So I really appreciate that. And I thank you very much, Andrea, for spending this time with me.
Thank you very much, Lauren. I'd really like to thank the co-authors, particularly though, from Food Bank WA, who took me in as the external evaluator, but it's really a team effort. I'd really like to thank the funders, so the Chronic Disease Prevention Directorate of the Department of Health here in Western Australia, and all those, the facilitators, and also the School of Population Health for funding the student dietitian originally. But really I'd like to thank JNEB, the reviewers and the editors. It's a bit of a tireless task, but the paper is much different from really the contributions made by the team. So thanks, Lauren.
Sure thing. And to all of our listeners, Remember, you can read this article in full at www.jneb.org for free for the next 3 months.